Okay, welcome class. It's Dr. Linder, and what we're going to be talking about in this next series is going to be the urinary system and the kidney. So this is just the abdominal view, so we can get a general idea as to some of the main parts and the orientation, just to get us a little comfortable with what we're going to be talking about. So um, let's start with the two major blood vessels that we see here. Okay, and this is important. We shouldn't forget about it. So we have the abdominal aorta here, and we have the inferior vena cava here. Why are these important? Well, we are going to be covering blood supply to the kidney. So if you look at the abdominal aorta, which is here, we see the kidney here. We can see right in here there is a blood vessel going from the abdominal aorta to the kidney, and that is referred to as the renal artery. Now, from the renal artery, there will be many, many branches, smaller branches that feed the microscopic parts of the kidney, and we'll get into that. Okay, but for now, just keep in your mind, oh yes, I remember the abdominal aorta, and there's a renal artery, and from that, it's going to be bringing blood and oxygen and nutrients to the kidney. And deep within the kidney, there's going to be a structure called a nephron that you can see with the naked eye. It's microscopic. And the nephron, one of the functions of the nephron is going to be to filter. So whatever is coming in here, whatever blood is coming in, the kidneys are going to filter it. And it's going to pull out a lot of impurities. And after it's been pulled out, it can return the clean blood into the venous system, into the renal vein. Now that's been cleansed and purified, it goes into the inferior vena cava. And from the inferior vena cava, it'll go into the liver, which would be somewhere here. It's not there, but it'll go into the liver. And it'll also find its way back to the heart, right? The inferior vena cava is one of the major blood vessels that goes to the right atrium of the heart. Okay, we can see both kidneys, and if we look and we take a closer look at them, we'll see that they're not level with one another. We could see that this is the right side, this is the left side, because we're looking at the individual. So this is their right kidney and this is their left kidney. We can see that the right kidney is a little bit lower than the left kidney, and the reason being, I drew in the liver here. So the liver being on the right side kind of pushes and forces that right kidney inferiorly. Okay. So besides the two kidneys, we see the adrenals, also known as the suprarenal glands. They are above the kidneys. From the kidney to the urinary bladder, there is a connection referred to as the ureter. So from the kidney to the urinary bladder, there is a connection called the ureter. Now, I don't want you to confuse ureter with urethra. They're not the same thing, they're not interchangeable. So let's understand the difference. One way that I teach my students to remember the difference is we are supposed to have two kidneys and two kidneys, two E's. Two E's, two kidneys. So the ureters are going from each kidney. You have two of them. So this is a ureter, this is a ureter. We only have one E in urethra. We only have one urethra in both male and female. Now there are differences between the male and the female urethra. And I will go over what those anatomical differences are. And it helps to explain why there are more UTIs, urinary tract infections, in women than in men when we look at the length of the urethra. Okay, so we got kidneys, ureters, two of them, a urinary bladder, and urethra. So these are the terms again: kidneys, ureters, urinary bladder, urethra. The kidneys are the organ that will produce urine. Now the question is, what is urine? Well, urine is a fluid that contains water, ions, and small soluble compounds. I already showed you what the ureters are. Those are the tubes that carry urine from the kidney to the urinary bladder. The urinary bladder is a muscular sac that will store the urine. And the urethra is the tube that carries the urine from the urinary bladder to the outside world, to the exterior. Two terms, urination and micturition. These are interchangeable terms that are just the process of eliminating urine. There is contraction of the muscular urinary bladder that's going to force urine through the urethra and out of the body, and it's controlled by the brain, the frontal lobe of the brain. The frontal lobe gives us the ability, when it's working well, to inhibit. So this is why when you have a baby has to wear diapers because the frontal lobe has not yet developed, so they can't inhibit or stop themselves from urinating. But as the baby gets older and they're 3.5, 4 years old, and 5 years old, and the frontal lobe develops, that child can now say, Mommy, Daddy, I think I have to go to the bathroom, right? And they could say, oh, can you hold it for 10 minutes till we get home? And the frontal lobe, when it's developed, can inhibit, and they typically can hold it. So what are some of the functions of the kidneys? Let's go over some of the primary functions. Some you may know, and some you may go, wow, I had no idea. I didn't know that. That's pretty neat. So one of the things that the kidneys can do is that it's regulating blood volume and blood pressure. Yes, the kidneys are involved with blood pressure. And how does it do that? Well, by adjusting the volume of water loss. So when you hold on to water, if you hold on to water, you typically hold on to salt and sodium and minerals, right? Minerals and water are always together. That's why it's called mineral water. Wherever water goes, minerals typically follow. Okay. So if you're holding on to water and you're holding on to minerals, well, you're going to increase your blood pressure. If you decrease the water, that means you have less water, less salt, less minerals, you can lower the blood pressure. Okay. The kidneys are involved in regulating blood pressure, and it can use two hormones to influence that. It can influence blood volume and blood pressure by using erythropoietin, which is typically referred to as EPO, erythropoietin, and renin. Erythropoietin is released by the kidneys, and erythropoietin goes to the bone marrow, goes to the bone marrow. And what happens in the bone marrow? Well, that's where red blood cells are produced. It's called erythropoiesis. Erythropoiesis, meaning red blood cell production, is stimulated by erythropoietin. Erythropoietin creates erythropoiesis. You increase red blood cells, you increase blood volume, and you can increase blood pressure. Renin is that hormone that is responsible for converting angiotensinogen. Remember, anything that ends in -ogen is inactive. Angio means blood vessel. Tensin sounds like tension. It has something to do with blood pressure, but it's inactive because it's got an ogen at the end. So angiotensin can be converted into angiotensin 1, and then angiotensin 1 can be converted into angiotensin 2. Renin comes in right here and converts angiotensin 1, converts angiotensinogen into angiotensin 1. That's what renin does. And then what converts angiotensin 1 into angiotensin 2 is angiotensin converting enzyme, which is called ACE. Angiotensin converting enzyme is made by the lungs, and it converts angiotensin 1 into angiotensin 2. And what does angiotensin 2 do? Angiotensin 2 is responsible for increasing your blood pressure. And we'll talk about all the different ways angiotensin 2 can increase your blood pressure. And that's why when people have high blood pressure, they may take an ACE inhibitor. What does an ACE inhibitor do? It blocks ACE. It's an ACE inhibitor. So, of course, it blocks ACE, which means you can't convert angiotensin 1 into angiotensin 2. And if you can't get angiotensin 2, you won't increase blood pressure. All right. So, what else do the kidneys do? The kidneys are involved in regulating plasma ion concentrations like sodium, potassium, chloride. And how does it do that? By controlling the quantities that we lose or conserve in urine, right? So your kidneys can get rid of sodium, or it can hold on to sodium, or it can get rid of potassium or hold on to potassium. And different hormones can influence that. Okay. Another important ion, we have calcium levels that can be regulated through the synthesis of calcitriol. And calcitriol is what we call vitamin D. Vitamin D. So, although it's a vitamin when we take it in supplemental form. When we produce it, vitamin D is really a hormone. And our kidneys are involved in producing vitamin D. I'll show you the different parts that are involved in producing vitamin D, but it shows you how important having healthy kidneys are in the production of vitamin D. The kidneys are also involved in helping to stabilize blood pH. We know that blood pH is somewhere between 7.35 and 7.45 pH. So the average pH of blood is 7.4. And when we look at the pH scale goes from 0 to 14, and right in the middle is 7. Anything from 0 to 7, of course, is an acid, and anything above 7 is a base or an alkaline. So blood pH, which is 7.4, is right around here, right? That's 7.4. So blood is slightly basic or slightly alkalinic. Whereas if we look at the stomach, we have hydrochloric acid in the stomach, HCl, hydrochloric acid. The pH is 2.3. Well, that's acidic. Hydrochloric acid, 2.3. Right? So that's a little bit about pH, but the kidneys are involved in regulating it by controlling the loss of hydrogen and the loss of bicarbonate ions. So the more hydrogen you have, if this is, let's say, a beaker, and we have some sort of, um, let's say we have water in here, and we add lots of hydrogen in here, lots of H's, H pluses, we have lots of hydrogen. The more hydrogen, the more acidic. If we have a beaker and we have more bicarbonate, OH, the more bicarbonate or OHs than the more basic. Okay, so our body can control one of the mechanisms. One of the mechanisms is going to be through the kidneys and urine loss. The lungs are another mechanism that we have. Okay. The production of hormones. So we know that our bodies can produce vitamin D, which is a hormone, and erythropoietin, which is EPO. It's another hormone. That's kind of important. Remember, erythropoietin is responsible for increasing red blood cell production, red blood cells. EPO goes to the bone marrow, and the bone marrow is responsible for erythropoiesis. The kidneys are involved in the excretion of wastes and foreign substances. So we have the liver and the kidneys. Both work together to excrete waste and to detoxify the body, right? Involved with detoxification. I do have a video on liver detox. If you look at liver detox or detoxification, I talk about phase 1 and phase 2 of detox, and the kidneys are involved in phase 3. So they kind of work all together. And the kidneys are involved in the regulation of blood glucose. The kidneys can carry out gluconeogenesis, which means the production of glucose from different sources when you're in a fasting state and you're not consuming sugar. This is just a great picture illustrating how our bodies produce vitamin D. So we need sunlight, we need UV rays coming down, and it hits our skin, and we have subcutaneous cholesterol in our skin. And the subcutaneous cholesterol in our skin makes these cholesterol precursors. Those cholesterol precursors go to the liver, and the liver hydroxylates it. So it's called 25 hydroxy vitamin D3, or it's called 25 OH. And then that 25 OH goes to the kidneys and produces 125 OH, or 125 dihydroxy vitamin D3. And this is involved in maintaining calcium balance in the body. Okay. When we want to assess your vitamin D levels in your body, the gold standard test is this one right here. The blood test for your vitamin D status is called 25 hydroxide, 25 OH. And most labs will tell you that healthy range is between 30 and 100. For me, I think that sweet spot is somewhere around 55. That's really, even though this is the range, we know that optimal levels are around 50 to 55-ish. That's more optimal. Okay. And whenever supplemental vitamin D is taken, it should always be D3, and that supplementation should have D3 with vitamin K in the formulation. Not just vitamin D by itself, it really should have vitamin K in the formulation. The reason being is that vitamin D helps us absorb calcium. All right. Now you have calcium circulating in these small little blood vessels. Okay, so you have calcium in here, and we want to get the calcium that's in the blood into the bone. And vitamin K is responsible for helping drive the calcium that's in the blood vessels into the bone. If you're vitamin K deficient and you have lots of calcium in your blood vessels, then blood vessels can calcify. And if the walls of the blood vessel calcifies, that can increase your blood pressure. All right, so D3 with K. In order to know how much vitamin D you need to take, it really depends on your blood levels. Um, you can see that they sell it typically in like 1,000 international units or 2,000 international units. I'm going to say the majority of my patients are starting somewhere around 5,000 international units because In the Northeast, we don't have direct sunlight through, like September to, early May. So most people in the Northeast are quite deficient. So typically they start somewhere around here. Some people are even at 10,000 international units, depending on how low they are. Okay, but it has to be monitored closely, and usually every 3 to 4 months you reassess. All right, so the kidneys are located to the right and the left of the vertebral column between the levels of T12 and L3. And because it's in the lower back, right, T12 to L3, when people are developing kidney stones or they're passing a stone, often people experience lower back pain and they think they're having muscle spasms or a disc problem when in fact they are forming kidney stones that are moving through the junction of the ureters, and it is extremely painful. Trust me, I had one this past year, first one of my life, and I thought I was having just lower back spasms. And it is, if you ask any woman that was pregnant that has had a child, and you tell them to compare the pain of that to kidney stones wins. Okay, so technically, I know what it's like to have a baby, and it was not fun. The right kidney is slightly lower than the left kidney, and that's because of the liver. The liver pushes that down, and it has the adrenal gland that lies above the kidney. The kidneys are referred to as retroperitoneal, meaning retro, it's behind the peritoneum. Retroperitoneum. Good place to take our first break. Then when I come back, we'll talk about some of the regions of the kidney.